Hey, this is Andrew Walker of PhysioWorks and going live right now from Huntsville, Alabama. And we'll see if anyone wants to come on and talk. We're going to talk a little bit this lunchtime about a topic that sounds very boring, but actually is a topic that I keep coming back to with various athletes that I work with. And this might be athletes who are working on performance, working on injury prevention, but also it may be one for those who are injured. Actually, it is one of those people who are injured. It's a topic that I keep coming back to again and again, and it's the idea of tissue tolerance. So just like any other material, the tissues of our body, be it muscle, tendon, ligament, bone, they have a tolerance to load. And we can think of it the idea of material properties. So, unfortunately, we heard this horrible story about a bridge the other day that collapsed, and we don't know all of the details. At least I haven't seen all the details. But typically, when things break, there is an intolerance to load. So we might see a crack developing in a bridge, and that's because maybe the load is, the material is not very tolerant to the load, and gradually that crack develops and it gets worse and worse and worse. Well, we see the same with bones. For example, someone runs and they run more than the capacity that bone has, and they may start to develop a stress fracture. Same with tendons. We see the person loading up that tendon more and more and more, maybe more than it can take, and then we start to see a tendinopathy develop. The same is true with all tissues. So when we're trying to improve someone's training, we've got to make sure that we take tissue tolerance into account. We need to make sure that we're building things up slowly and steadily enough so that we do not injure ourselves. That's where that whole 10% idea comes in within people's training, or that's where the idea of the acute chronic workload ratio comes in, that I know I've talked about and blogged about before, comes in. It's the idea that we want our loading to be gradual and progressive to give the body chance to change its structure. And that's the great thing about the human body compared to, say, a bridge. When you build a bridge, you made it out of concrete, it is as it is. You can't, without going in there with an engineering team, you can't make it stronger. Whereas a human body, when you're actually loading that tissue, the human body can respond to it, and it can send more collagen, for example, to the tendon to make the tendon stiffer and stronger. And that is an amazing thing. So as an athlete looking to reduce injury, you need to make sure that your tissues become tolerant to the load that you want to do. So that means that gradual progression of mileage, gradual progression of speed, gradual progression of hill work. That may also mean, depending on your history and depending what you like as an athlete, that you need to have a certain amount of strength training, or you need a certain amount of plyometric training to help, again, to build that tissue's tolerance up. So the same discussion happens when someone is actually recovering from injury. First of all, we know that the injury probably in a lot of cases happened because that tissue was intolerant to load. But then in terms of coming back from injury, we've got to build that tissue back up. We've got to build that tissue's tolerance to load back up. So in the case of a tendon, the tendinopathy, which is already a degenerative condition rather than an inflammatory condition, it occurred due to overload of the tendon. So we've got to make sure that we progressively load that tendon back up so that it can gradually progress and become stronger. And as the tendon progresses and becomes stronger, you're then able to do more with that tendon. That tendon is able to better absorb energy and release energy, just like a spring. The same is true of a stress fracture. If someone's coming from a stress fracture, we've got to do enough load so that that new bone starts to form, and we've got to make sure we don't do too much load. So a progressive return to running program is what's indicated there, and this is where some of the controversies come in orthopedics. So if someone has had a stress fracture, if they are offloaded too much, we actually see an underloading effect, whereby we're not actually seeing an improvement in the structure of that bone. And so sometimes, we see people come through having a stress fracture, they're put in a boot, they're given crutches, and they're significantly unloaded. And then the doctor takes them off of the crutches, tells them to start not using their boot, and all of a sudden their pain comes back. Now, they may not re-injure their stress fracture, but their pain comes back because they've significantly underloaded that area, and the structure is very, very weak now. And even a small thing like a little, 1 minute run is a lot more than that bone has been doing in the past few weeks. So all of a sudden, that can actually be a big overload relative to where it's been at. So the controversy is, if you offload people too much, it takes a very, very gradual process for them to get back. So the offload after an injury has to be enough to allow the tissue to settle back down, but it doesn't need to be too much that you actually lose a lot of the properties of the tissue and make the recovery a lot longer. So sometimes I see people who've been offloaded too long, they go back to trying to run and it becomes sore, and every now and again they re-injure themselves just because they've lost so much material property. And it's the same principle we work by when we're looking at people with osteoporosis, where they've got thinning bone. If they're not doing good weight training, they're not putting load through the bone, they're not encouraging bone growth. And the same is true recovering from a stress fracture. You need to have enough weight that you're not stressing it out too much and exceeding the tissue tolerance or the mechanical properties of that bone, but you need to load it up enough that you are actually encouraging bone to form. This is a very important topic, and it's something that I could ramble around a lot, and I'm hoping I'm coming across clear here, but it's something I talk about with most of my patients, and talk about when I do seminars and stuff on injury prevention and performance. Does anyone who's watching around, I think it's two of you, I see Ali's joined, does anyone have any questions that I might be able to answer? I haven't done many lives before, so this is a learning process to try and be natural behind the camera. Anyone who knows me knows that I'm a pretty chilled out and relaxed person, and so if I'm coming across a little bit tight, that's just not being used to Facebook Live. But any questions that anyone has about stress fractures, tendinopathy, the idea of tissue tolerance, the idea that we want to stress the tissue just enough, but we don't want to stress it too much. Now, if you do have questions and you don't want to ask them on here, you can always send me an email at andrew.walker@physioworkshsb.com. You can give me a call, 256-529-7395. As a small business, and the business model I have, I answer all my own phone calls. So if you call and I'm not on a Facebook Live, I will answer that call and I will speak to you directly. And I offer screening appointments, free screening appointments, as a way to help people to see if physical therapy can help them, and particularly to see if I'm a good fit for people and the way I do things will work for them. I realise that that's not for everyone, but also it gives me the chance of giving you guidance if you actually need to have any different investigations or see a different specialist. So let's see. So Ali's just put a question in. Is there ever a tendinopathy that doesn't really heal and is always an issue, or is there always something you could do? That's an interesting one, because unfortunately, every now and again, you do get a patient with a stubborn tendinopathy, one that is not that's not responding like you would like it to do or like you would expect it to do. And typically tendinopathies, they respond to a progressive loading program. We start off with isometrics. Isometrics are a great painkiller for tendinopathy, and then we progressively load that tendon. But sometimes people keep flaring up, or they don't settle down in the way you predict. And when that's the case, you start to think, are there other things going on? So is there a tear within that tendon that perhaps wasn't diagnosed on the MRI? Because let's say they've had an MRI. MRIs don't always clearly show everything. You get false positives, you get false negatives. So that they might have a false negative. So sometimes further imaging can be warranted. But there are other factors it's not just an issue in the tissue, as we might like to say. There are other factors that play into people's pain. So we actually found a study on gluteal tendinopathy, so gluteal being right on the outside of the hip, used to be diagnosed a lot as hip bursitis, but really is more like gluteal tendinopathy, that anxiety, stress, and depression are very highly linked to gluteal tendinopathy. So, I mean, hopefully they're things that I have picked up in some of my examination and discussion with my patients before, but sometimes there are things that patients don't tell you about, or they're things that are kind of ongoing while you're working with them, and they weren't necessarily an issue when you first saw them, but they could be something that actually slows down their progress. So we do need to take some of those things into account. And then there are other things that play in. So diabetes, for example, or we know that as an antibiotic class called fluoroquinolones that are not very helpful for tendon health. So yes, unfortunately, there are some tendinopathies that don't heal, but typically I see a really good response with tendinopathies using the latest studies and research and this progressive loading approach that I just mentioned. Now, there are other treatments that you can try, and I'm not opposed to people trying them. So examples would be, for example, PRP, platelet-rich plasma. The research, there's not tons of it, and what research that's been done is not necessarily great quality yet. So I don't think it's something that's a first-line treatment, but for the person who's got a tendinopathy that's not responding, I think it's very worth trying. And when I say not responding, I think it's the sort of thing, if you've been doing the right things for a year, for example, when you're not seeing a change, that's probably worth trying. And it's certainly an expense. I think I heard someone quote me like $700 or $800 for a PRP injection, at least around the hip last time I heard. So that's something that people can consider. I probably would go there before I'd consider myself having a steroid injection, because we know that tendinopathy is a degenerative condition of the collagen in the cells. So the collagen is kind of breaking down. Normally collagen is pretty linear, so it can take stress, and when you have overloaded the tissue, the collagen breaks down and it basically becomes ill-aligned and it can't take load so well. And when you have a steroid injection, it actually slows down the turnover of collagen cells, so you don't get recovery of collagen cells so quickly. You don't get new cells so quickly. So we think that there's a link between steroid injection and deterioration of tendon cells. So PRP, as far as we know, doesn't really have any major side effects like that. So I would personally go for a PRP injection before I would go for a steroid. And then, there are other emerging things that we really don't know very much about yet, like stem cells. We just don't have, very much research, and we don't have lots of high-powered research as well. Because that's the other thing with research. It's all well and good having a case study presented that shows that something works, but doesn't mean it's going to work to you or the other person. It may even have a series of studies where there's maybe 10 people in a study. Again, it doesn't necessarily mean it's going to work for you. So really good high-powered research that is randomized, so it's not, we take away and we control variables, so that helps us to then apply things to a greater part of the population. And wow, someone's doing a bunch of different emojis there. When we unfortunately, with the human body and with research, there's only so much research that can go on. So it's going to take a little while for some of that research to catch up. But at least from a physical therapy perspective, most of the patients I see respond really well to exercise. And so I would encourage people to go for a conservative exercise-based approach before they try anything else, because it's also the least risky one, the least side effects. Does that answer your question, Ali? If you're maybe still with us? Does anyone else have any questions as well? Maybe it's had his thumbs up there. Does anyone have any other questions about the idea of low tolerance of tissues, stress fracture, tendinopathy? I'll be happy to stay online for a little bit longer and answer some. That's all right, Ali, your internet connection crashed. You can go back and look at the feed afterwards and see what I said. Hopefully it all made sense. All right, there's two other people watching. I don't know who it is, but any other questions? I'm going to try and come on live periodically, and I'll try and bring up some different things to talk about. So I will leave you. Oh, she saw most of it. Okay. So anyway, I'm going to head now and get on with a bit more work. Try and write some more blog articles. Hopefully you're catching the blogs at physioworkshsv.com/blog. If you have blog topics you'd like me to cover, I'm always open to looking at new things, so do feel free to drop me a message, send me an email, give me a phone call about blogs. Also, if you've got questions you don't want to ask on here, I'm also happy to talk on the phone or email. So phone number is 256-529-7395 and email is andrew.walker@physioworkshsd.com, and physioworkshsd.com is our website. And you'll take care, and we'll speak to you soon.